Dave Scott Hub Media. Today we're starting a brand new podcast with Jess from Absolute Home Care. You are the clinical nursing leader. And when we talked last week off air, I was blown away by what you guys are doing and sort of the need in our community to have folks like you doing what you do. Um, First of all, tell us a little bit about Absolute Home Care. Who are you guys? What are you guys doing? Lay it out there for me.
Absolutely. Thanks for having me. I'm really appreciative of that. So basically what we are at Absolute Home Care is we are a division of Absolute Respiratory, which is a respiratory company that's been around for at least 15 years here in Simcoe, and as well as in Tilsonburg, which was opened, I believe, in 2013. And so basically what happened was the owner named Lindsay, she realized that there was a huge gap of care in the community and realized that branching into home care would be very, very helpful. So basically what we do is we do in-home nursing care, which includes foot care and other general nursing tasks. We do personal support work, which includes personal bathing as well as companionship in the community. And we do exercise therapy as well. And those are kind of our main things that we focus on. And yeah, that's who we are.
Do you guys do Haldeman and Norfolk, or are you guys just Norfolk right now?
Yeah, so we do Norfolk and Haldeman as well. And we're actually looking to branch more into Oxford County now.
Where do you see early on, you guys, I don't, how long have you guys been going now?
So about a few months we've been
Okay.
going. We launched in January.
Can I ask where you're seeing the growth right now?
Yeah, absolutely. So I am noticing a lot of clients coming on for foot care. So that is a huge gap that I've personally seen as a nurse in the community, and people aren't having enough access to it. So we do have local foot care nurses, but they just, they're a one-man show. They can only take on so many clients, and people are really, really struggling finding that. So I'm finding that that's kind of where we're growing a lot, as well as our exercise therapy, because that is something that is also hard to come by as well.
And what's your background in nursing? Do you mind sort of telling the folks how long you've been doing this and what you've been up to?
Yeah, absolutely. So I have been a registered practical nurse since 2018. I started out in pediatrics. It's more of like a family medicine practice, which I loved. That was great. That was in Toronto. And then I did a little bit of public health with the COVID situation that had happened. So I helped with the COVID situation and did vaccines and things like that. And then I found home care, and I really, really found my passion there. I love it. I love being able to help people stay in their homes. And I've been doing that ever since 2021. And I have found my home for sure.
And I know that you're not the only member of the team. Maybe tell us a little bit about your team.
Absolutely. So our team consists of Lindsay Ross, who is the owner of the company, both Absolute Home Care and Absolute Respiratory. And she is a registered respiratory therapist. And she is a true local girl. She is from Simcoe, and she's been around here her whole life and comes from a line of Norfolk business owners. So she's very passionate about being a part of the community here. And then we have Jamie as well. She is our exercise therapist. And she has a strong background in wellness and exercise. And she's also local too.
Wow. So you got a lot of bases covered here when we were talking. I didn't realize looking at your website, which is absolute-homecare.ca. Check it out, folks. All the stuff you guys were doing and how involved you are so quickly in the community. A little bit about, I mean, you sort of touched on your background, but what brought you to nursing?
Yeah, I would say what brought me to nursing is I actually started as a personal support worker, and I was doing long-term care as well as a little bit of community work as a personal support worker. And I think it's just my innate drive to help people. I really am passionate about helping people better their lives and becoming, the best version that they can be, or even just being able to have the freedom to be at home, because there's obviously absolutely no place like home, and it's hard to be displaced from that. So I think it just comes from a line of really wanting to help people, as well as my grandma is a nurse as well.
Oh,
So
cool.
that kind of, I watched her growing up, and that really inspired me.
It's funny how that influence trickles over, isn't it? In your
Yeah.
life, like you'll see your family member or a friend do something, you're like, wow, that feels important to me. Like I want to be involved in that aspect. And I really appreciate nurses, especially because they make such an impact. And I like that you touched on that folks want to stay in their own homes longer. And this gives them the resources, right, with your programs that you guys can come in and help them out. Sort of talk about a typical day and what you may do and help folks.
Yeah, so typically I'll start with maybe nursing. So, as I said, we go into clients' homes to help provide foot care. So, a big demographic of that would be people who suffer from diabetes. They're at a
Mm,
higher risk of maybe injuring their foot, getting a wound, that kind of thing, as well as some people have mobility issues and they're not able to reach their feet. So, their toenails grow really long and thick and they need help with that. So, the nurse is able to come to the comfort of their home, perform the care, and they don't have to worry about getting a ride to a clinic or trying to arrange that because we come to them. The same goes for personal support. So, a personal support worker may come into somebody's home, help them with a shower. They may do some meal prep with them. They may also just spend some quality time. A lot of seniors become isolated, and sometimes they just need that person to come a few times a week and spend time with them doing things that they love, like playing cards or things like that. And then on the exercise aspect of that, Jamie goes in and does a whole assessment and sees kind of, are they having pain? How can we improve their mobility? How can we prevent falls? Because falls are a huge, huge risk for a lot of seniors living alone. And, strengthening helps with preventing falls. And what I love that Jamie does is she just goes into the home and finds what's in the home and works from there. So if they're lifting weights, it's a can of soup, so
yeah.
it makes it really, really simple to teach people how to be active in their own home.
That's pretty cool too, and at some point we've got to get Jamie on the show for sure. The other part I wanted to ask about medications because that's something else that you guys would be helping them with, right?
Absolutely.
Sort of walk me through that because I noticed. I remember my grandmother; she would just have literally a shelf of pills, and I'm like, how do you even know, right? 80 years old in her 80s, late 80s, and she still was doing it. But I was just always amazed that helping someone just sort of especially when you age, I mean, you will lose a little bit of memory somewhere in there. I mean, I'm doing it and I'm only 60. So, you know what I mean? I mean, obviously, it's when someone's in the home to help you sort of, I don't know what the word is. I want to, like you said, sort of set that agenda for them, help them sort of see clear for the next week or 2 weeks, whatever they need to do, right?
Exactly. Yeah. And that's definitely something we're able to help people with. I mean, when something happens, for example, somebody, has a heart attack, a stroke, and
Yes.
it follows, from the hospital, you've got this huge list of medication. You're trying to remember, okay, I take this in the morning, I take this one at night, I take this one at lunch. So just going in and helping them to organize that and helping them to gain access to maybe like a medication doset, which is one of those little plastic containers that you can organize the medication in, or even advocating for them to have the pharmacy do that for them. A lot of people don't realize the services or different ways to do that. So we're able to go in the home and help them navigate.
And it's just, I mean, I think just that check in part too, right? To know that I like what you said about playing cards or just having a conversation because I think that's critical, especially when you want to live at home as you age. Maybe you're not driving now, or maybe you're not driving as much, and you just need that. I think that's surrounding yourself with community, and that's kind of what you guys are doing is helping with that aspect of it, is it not?
Absolutely. So, one thing that I saw a lot and still do see in the community is there are maybe it's an elderly person who has lost their spouse. They live alone. Their kids live in a different city, maybe Toronto. And the kids obviously come and visit on the weekends and things like that. But a lot of family members have other responsibilities. So they've got a 9 to 5 job they have to be at, and they can't always be there to make sure that mom or dad is okay. So what we do is we can come in a few times a week, once a week, every couple weeks, whatever works for the person, and just check in on them. Say, hey, how you doing? Do you want me to bring you a coffee? Can we help you with anything around the house? Or maybe they just want to go for a walk around the block, and just making sure that somebody has eyes on them because they are living alone, and that can be living at risk depending on the situation.
Can we talk a little bit about sort of what measures you guys put in place? Because obviously you guys have had all your background checks and all that stuff, sort of let the folks know so that they know that you're legit, right?
Absolutely. So, one thing that I really love about us is all of our personal support workers have to be a part of the PSW Association of Ontario. And they also have to have criminal background checks. Obviously, everybody in healthcare needs to have that when you're working with vulnerable people. And we also do our best to hire people that live locally that really do want to make a difference in their community. So those are kind of things that we have put in place to make sure that we are hiring high quality people that really do love to do this kind of work.
That's cool. How do people get a hold of you guys? Sort of give it phone number, email, so all that information. So if they see the video and they want to reach out and hang out with Jessi, they can do it, right? Hang out with
Yeah,
Jess.
absolutely. Absolutely. So, the best way to reach us could be through telephone. And our phone number is 519-426-0413. We also have an email address as well if people prefer to communicate that way, and that is info@absolute-homecare.com. So either way is fine for contacting us, and we're more than happy to answer any questions. And then if we want to move forward, we would come out and do an assessment and figure out what the needs of the client are.
And it would the phone call costs nothing, right?
Exactly.
People can just sort of say to you, "Hey, here's my situation." And I think that's the important aspect to find that comfort zone and see if there's a good fit with you and the client, correct?
Absolutely, absolutely. And there's no charge for the phone call or communications. Really, our mission here is to figure out how we can help people the most. So, just giving us a call and saying, hey, this is my situation. What kind of services could you offer me to help? We're more than happy to answer any questions and figure out if we would be a good fit to help out.
Jesse, this is great. I love it. Keep up the great work. Let's talk again next time and maybe break down some of these individual areas that you guys help in. Absolute Home Care, Simcoe, right?
Yep,
Go
Simcoe.
see him. Give him a call. Check it out, folks. Thanks for doing this.
Yeah, thank you so much.